Let's explore a veneer case using our Obsidian Lithium Silicate Ceramic material. This high-strength monolithic ceramic is more than just strong, it's also beautiful. Let's see it in action.
In this next case, patient was unhappy with her gummy smile, her teeth, and her facial profile. After carefully planning the solution to her problem with our in-house oral surgeon, Dr. Peter Scheer, her treatment included aesthetic crown lengthening by gingivectomy and ostectomy to reduce the amount of gingival display, and also genioplasty to correct her facial profile. After all options were presented, patient also agreed to 10 prep veneers using our Obsidian Lithium Silicate Ceramic. To demonstrate what the possibilities were for improving patient's smile, a cosmetic resin mock-up was performed chairside at the consultation appointment. Using the diagnostic wax-up, I did the mock-up using a Putty wash impression matrix, and after injecting Laxatemp material, I placed it in the patient's mouth. After the patient had the opportunity to look at her smile, the decision was made for 10 Obsidian veneers that will have the centrals longer than the laterals. After the gingiva was allowed to heal from the surgery, another pre-evaluating set of temporaries was used that took in consideration the gingival repositioning. I used this set to place facial depth cuts. Here I use a depth cut burr from Brasseler, USA that provided a 0.3 mm depth gingivally, 0.5 mm at the middle third, and 0.7 mm incisally, providing a preparation that follows the 3 different planes. Once I was done with the depth cut, I marked the horizontal grooves with a pencil and used the curette to flick the matrix off. To finish the preparation, a 856012 round-ended diamond burr was also used from Brasseler. This temporary mock-up prevents any unnecessary entry into the tooth and helped me keep the preparation on the enamel and precisely control my facial depth cuts. Before final impression, patient wear the temporary for an additional week. Great care was taken to open the gingival embrasure so not to create any damage to the papilla. At the final impression appointment, almost always after the removal of the temporary, there will be some area that needs to be cleaned up, and so using a white stone will remove any residual from the area where the temporary was spot etched. Using a double core technique to expose the tooth apically will definitely aid in the help of the technician to see the tooth below the margin so that the technician will have a better idea on how to contour the margin and blend the obsidian material into the existing tooth contour. Before taking the final impression, I use grip strip to carefully separate the interproximals so that the technician could see the margins. After removing the second cord, I use Capture Vinyl Polysiloxane Impression System. Here I'm syringing medium body on the prepared teeth while my assistant was loading up the tray. A full arch impression material was filled with Capture Heavy Body. The impression was left to set in the patient's mouth for 3 minutes. Also, a hard bite was taken with Capture material. In order to better communicate the shade to the lab, also Stump shade was taken. Available in Vita Classic and bleaching shades, Obsidian material has great optical properties and it can be pressed or produced via CAD-CAM. Here is the final cementation appointment. Obsidian pressed veneer were tried in with water to ensure color and to ensure that everything fits. At this point, the patient got a chance to look in the mirror and approve her new restorations. After cleaning the prepared teeth with Preppies Plus from Whipmix, G5 was put down as an antibacterial and desensitizer agent, and because the preparation was on enamel, I could use an A-dec air to dry to prevent any contamination. A and B primers was applied to get the tooth ready for the resin cement. Prior to cementation, the intaglio surface of each veneer was treated with Ivoclean for 20 seconds. Before loading the veneers with multi-link, Also, Monobond Plus was applied for 60 seconds. In terms of isolation, I used cotton rolls and metric bands. The veneers were placed in 2 sets at a time and held into place using wooden sticks, applying light pressure on the facial and the incisal to ensure correct seating. For this case, I thought was easier to bond the veneer in place starting with the posteriors to get them out of the way. Then I went back to the 2 centrals and worked my way towards the cuspids. Prior to the final cure, I used small amount of glycerin, liquid strip from Ivoclar to ensure that there will be no oxygen inhibiting at the margins. Once the veneers were tacked and waved into place, the matrix was removed to allow the removal of excess cement. I used an explorer to cleave off the excess and a little saw to separate the cement from the interproximal area. With an average biaxial strength of 397 megapascals, Obsidian Lithium Silicate Ceramic exceeds the strength requirement for all ceramic restorations, making this material a good choice for this case because the veneer were extended posteriorly to the maxillary premolars. Patient bite and lateral extrusion were checked and final restorations were evaluated for phonetics. After all the necessary adjustment, a rubber cup was used to polish the final restoration. Overall, this Obsidian Smile makeover exceeded our patient expectation.
Well, that about wraps it up for this episode of Chairside Live. On behalf of everyone here at Glidewell Laboratories, we thank you for watching and hope you'll come back next week.